Acute liver failure, also known as fulminant hepatic failure, is a medical emergency where the liver suddenly stops working properly. This condition is different from chronic liver disease because it happens very quickly in people who previously had a normal, healthy liver. Your liver is responsible for filtering toxins, producing proteins, and regulating metabolism, so when it fails, the consequences can be devastating. Toxins build up in the blood, the body struggles to clot blood properly, and vital organs can start to fail. Unlike chronic liver disease that develops over months or years, acute liver failure happens rapidly, often in people with no previous liver problems. This quick onset makes it particularly dangerous because your body has little time to adapt, and other organs can be affected quickly. It should be noted here that acute liver failure is rare, affecting about 2,000 to 3,000 people in the United States each year, but it's incredibly serious. Without prompt treatment, acute liver failure can lead to complications like brain swelling, kidney failure, and even death. The good news is that with early intervention, many people can recover, especially if the cause is identified and treated quickly. Causes of acute liver failure. Acute liver failure can be caused by a wide range of factors, from medications to infections. Here are the most common causes. Number 1. Acetaminophen overdose. Acetaminophen, or Tylenol, is one of the most common causes of acute liver failure. Taking too much acetaminophen, either accidentally or intentionally, can overwhelm the liver's ability to process it, leading to toxic buildup and liver damage. Sometimes, even taking slightly more than the recommended dose over several days can cause problems. Number 2. Viral hepatitis. Hepatitis viruses, particularly hepatitis A, B, and E, can cause acute liver failure. These viruses attack the liver cells, leading to inflammation and damage. Hepatitis B is the most common viral cause of acute liver failure worldwide. Number 3. Drug reactions. Certain prescription medications, herbal supplements, and recreational drugs can cause liver damage. Antibiotics, anticonvulsants, and nonsteroidal anti-inflammatory drugs, or NSAIDs, are among the most common culprits. Number 4. Autoimmune hepatitis. In this condition, the body's immune system mistakenly attacks the liver, causing inflammation and damage. If left untreated, it can lead to acute liver failure. Number 5. Mushroom poisoning. Toxic mushroom poisoning, particularly from death cap mushrooms, can cause severe liver damage within days of consumption. Number 6. Wilson's disease. This rare genetic disorder causes copper to build up in the liver and other organs. In severe cases, it can lead to acute liver failure, especially in young adults. Symptoms of acute liver failure. The symptoms of acute liver failure can develop quickly and worsen over time. When the liver first struggles to function, you will feel extremely tired and weak. This fatigue can be overwhelming and doesn't improve with rest. It's not just the usual tiredness after a long day, it's a deep, unshakable exhaustion that makes even simple tasks feel impossible. One of the hallmark signs of liver failure is jaundice, where the skin and eyes turn yellow. This happens because the liver can't process bilirubin, which is a waste product that builds up in the blood. You might notice a yellowish tint to your skin or the whites of your eyes, which can be alarming if you've never experienced it before. Many people with acute liver failure also experience nausea, vomiting, and a loss of appetite. These symptoms can make it difficult to eat or drink, leading to dehydration and further complications. You might feel constantly queasy, and even the thought of food can be unappealing. Pain or discomfort in the upper right side of the abdomen is common as the liver becomes inflamed and swollen. This pain can range from a dull ache to a sharp, stabbing sensation, and it might worsen when you press on the area. One of the most concerning symptoms of acute liver failure is hepatic encephalopathy, which is a condition caused by the accumulation of toxins in the brain. This condition can make it hard to think clearly or remember things. In severe cases, it can cause personality changes, slurred speech, or loss of consciousness. You might notice also that your blood doesn't clot normally. Even small cuts might continue bleeding longer than usual. This happens because your liver isn't producing enough of the proteins necessary for blood clotting. Changes in urine and stool color are also common here. Urine may become dark, while stools may appear pale or clay-colored due to the liver's inability to process bilirubin. These changes can be subtle at first, but become more noticeable as the condition progresses. So, if you or someone you know is experiencing these symptoms, especially jaundice and confusion, seek medical attention immediately. Acute liver failure is a medical emergency that requires prompt treatment. Diagnosis of acute liver failure. Diagnosing acute liver failure requires a combination of medical history, physical examination, and various tests. Your doctor will ask about your symptoms, recent medications, alcohol use, and any exposure to toxins or infections. Be prepared to provide details about your health history and any recent illnesses. During the exam, your doctor will check for signs of liver failure, such as jaundice, abdominal tenderness, and swelling. Blood tests play a central role in diagnosing acute liver failure. Liver function tests measure levels of enzymes such as alanine aminotransferase, ALT, and aspartate aminotransferase, AST, which are elevated in liver damage. Bilirubin levels and coagulation studies, including prothrombin time and international normalized ratio, are also used to assess liver function and blood clotting ability. High ammonia levels in the blood may indicate hepatic encephalopathy. In some cases, a liver biopsy may be needed to determine the cause of liver failure. This involves taking a small sample of liver tissue for analysis. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for acute liver failure. Treatment for acute liver failure depends on the cause and severity of the condition. The goal is to stabilize the patient, address the underlying cause, and prevent complications. Here are the different treatment options. Number 1. Emergency medical care. The first step in treatment involves immediate hospitalization in an intensive care unit. Here, doctors closely monitor vital signs, manage complications, and provide supportive care. This includes intravenous fluids to maintain hydration and electrolyte balance, as well as glucose administration to prevent hypoglycemia, which is common in liver failure. Patients with coagulopathy may receive plasma or clotting factor concentrates to manage bleeding. Number 2. Medications to control toxins. N-acetylcysteine is a crucial medication, particularly in acetaminophen-induced liver failure. It helps prevent further liver damage and can improve outcomes even in non-acetaminophen cases. Other medications might be given to reduce ammonia levels in your blood, which can affect brain function. Anti-nausea medications and acid-reducing drugs help protect your stomach and prevent bleeding. Number 3. Treating hepatic encephalopathy. This involves reducing the levels of toxins, particularly ammonia, in the blood. This is achieved by administering medications such as lactulose, which traps ammonia in the gut and facilitates its excretion. Antibiotics like rifaximin may be used to reduce ammonia-producing bacteria in the intestines. In severe cases, patients may require sedation and mechanical ventilation to protect their airway and support breathing. Number 4. Infection prevention and treatment. Since liver failure weakens your immune system, preventing and treating infections is critical. You'll likely receive antibiotics to prevent infections, and any existing infections will be aggressively treated. The medical team will take extra precautions to prevent hospital-acquired infections, which can be particularly dangerous in this condition. Number 5. Liver transplantation. In severe cases where the liver damage is irreversible, liver transplantation might be necessary. This is a major surgery where the damaged liver is replaced with a healthy donor liver. The decision to proceed with transplantation depends on various factors, including the cause of liver failure, the severity of symptoms, and the likelihood of spontaneous recovery. At the end, while it is a serious and often frightening condition, with prompt treatment, many people can recover. The key is to recognize the symptoms early and seek medical attention immediately. Now, we want to hear from you. Have you or a loved one ever faced acute liver failure? What was the journey like, and what treatments made the biggest difference? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.